right, good afternoon, everyone. I know it's been a beautiful, long but beautiful day. I think everyone who has presented so far has provided such important and amazing insight to what we've been talking about today, which is the various different types of services and opportunities for those who may have addiction or know someone who may have some type of addiction. And I feel blessed and honored to be able to be in front of all of you and talk about CCHP and what we do, and also to share the space with all of you. It's been amazing. All right, so I'm just going to talk about who we are at CCHP and like some current statistics. How do overdoses happen, and how to recognize an overdose, and then we're going to go through the Naloxone training. Okay. So my name is Shannon Risbrook. My pronouns are she, her, hers. I'm the Community Engagement Coordinator at CCHP, Center for Comprehensive Health Practice. And I'm also the Program Director of the Opioid Overdose Prevention Program. So if anyone has any questions, more questions about opioid overdoses, not just what CCHP does, but what the city does, or just any general questions about opioids, you can come talk to me, or my email's at the end of the slide, so you can shoot me an email. All right. So we have been in East Harlem since 1960. We used to be part of Metropolitan Hospital, but then about 2 or 3 years ago, we moved out of Metropolitan Hospital, and now we're on 110th, like literally 1 block over. So we're in the neighborhood. We made sure we didn't leave the neighborhood when we left Metropolitan. And then this is some of our accreditation. You can just do that. All right, so our mission is to provide accessible community-based treatment that integrates primary health care with substance use and behavioral health services for all children, adolescents, adults, and families residing in East Harlem and the greater New York community. Our approach, it creates a lasting healthcare partnership between patients, families, and professionals. And our motto, our slogan is your family's home for a lifetime of care. We have some families at CCHP that has been there almost since its inception. There are generations of people who come to CCHP. So yes. All right. So I want to talk a little bit about our addiction services. Addiction services, there's not really a one-size-fits-all. So some of the stuff that you see here on the screen, not everyone who engages in our addiction services uses all of it, but we want to make sure that we're providing as much resources as possible. And if we don't provide that particular resource, we have our patient navigators here who are very good at reaching some other resources in the community, some holistic, some other organizations. Whatever anybody needs from CCHP, we make sure that we're able to provide it. And they're amazing at doing it. All right, so that would include individual and group counseling, vocational and educational services, peer support. We have peers who have lived experience and they sit with them, our patients, they give escorts to where we need to go. They can spend all day with our clients and our patients. We have Jose, who was on the panel earlier, and he is one of our reentry specialists, because that is a population that we have been trying the hardest to serve here in East Harlem. So then we have our medicated assisted treatment programs for those who are interested in using them. And then we have counseling for significant others, because we know that it doesn't just impact the individual, but the family as well. So, or loved ones, friends. So if you know someone who is impacted and wants to talk to a counselor about it, we have our program for that. And then, of course, we have our opioid overdose prevention program, which includes Naloxone, fentanyl testing strips, and xylazine testing strips. And a little bit later, I'm going to talk to you about how to use it and the testing strips as well. And then, again, our special populations, persons living with HIV/AIDS, pregnant persons and mothers, and the reentry population. So our primary care services, standard primary care, adolescent health, women's health, vaccinations, anything that a person may need, whether it's from school. We have STI and treatment, hepatitis C testing and treatment, HIV services, which includes a HIV case manager. So if someone living with HIV needs a little bit more help, like getting more services, resources outside of the community, we have our case manager for that. And including PrEP and PEP as well. And then behavioral health, adolescents and adults for the counseling and the psychiatric programs as well. And then I feel like I spoke about this, so we can keep it. So we're going to talk a little bit about the statistics, but I want to preface beforehand that there's a lot of things in the conversation about overdoses and just anything in general regarding substance use disorder is not quantifiable. You know, we have the statistics to show like one part of the picture, but you know, when I was in grad school, the reason why some of my professors didn't like me is because I kept telling them that you can't quantify a lot of this. Then the qualitative aspect of it is actually, in my opinion, a little bit more important. But to talk about the statistics a little bit, you know, it continues to be a public health emergency, and especially during 2022, every 3 hours somebody died of an overdose in New York City. And the highest being fentanyl. Opioids in general were involved in 84% of the overdoses in New York. And this is something I want to talk about a little bit more, because yes, Bronx and Harlem, and even like North Shore Staten Island, but for some reason they never want to add Staten Island in these statistics, but had the highest rate of overdose deaths. And honestly, if we want to be very real about it, a lot of it, they show this data, and while it is important data, they never want to talk about why, which is if you want to talk about the social determinants of health and looking in these neighborhoods, social determinants of health tells us that somebody's zip code can dictate what their quality of life will be. And that is because when you look at systemic racism, when you look at, you know, the resources that are available to people living in Black and brown neighborhoods, you know, you have to look at where the money is allocated, right? So, you know, unfortunately, these things impact the chance of somebody overdosing. Because it's not like the Bronx and Harlem are the only two neighborhoods or boroughs that are using. Right. All of them are, as you can see by the map. However, you can definitely see like where I guess there is a higher need for places like us and everyone in this room to make sure that these resources are coming to our communities.
And that means order.
Yeah. So, and then in 2023, there were 712 overdoses just in the first quarter. But a little bit of positive news, this is the first time in 4 years where overdose deaths are going down. So, that goes to show like how harm reduction is so important. And harm reduction is more than just the medicated assisted treatment program. It's more than just the counseling. It's about empathy, right? Meeting people where they are. And you know, earlier in the panels, people were talking about not feeling like we're the experts in people's lives, but letting people come to us and telling them these are the resources that I need. Harm reduction could be something simple as if somebody needs a dog, a place to live, a meal. You know, not just talking about abstinence from whatever their substance is, because some people don't want to be abstinent from the substances that they're using. You know, so it's about making sure that they get every single resource that they may need in order to live the lives that they feel like they will be truly worth living for themselves. And we don't dictate what that is. All right. So we're going to talk about the naloxone. Okay. So we have Josephine and Trey Jor. They're going to be passing it out. And I want to talk about what's in the bag, how to use it, why we use it, all that fun stuff. Okay. And then I'm going to grab one. Okay, so as we're passing it out, we're going to talk about, by the end of today's training, you should understand how an overdose can occur, recognize the signs and symptoms of an overdose, and know the steps on how to respond to an overdose. So how do overdoses happen? So let's think about it in kind of like a lock and key mechanism, right? So in your brain you have receptors, pain receptors, right? Or receptors for different types of things. The opioid is like the key. So the opioid would enter one of the receptors, and that's how the opioid works in the brain. It's kind of like that question when people ask, how does Advil know where the pain is at? Because the pain, they have certain receptors, and the Advil goes to that receptor, and that's how it targets the pain. It's the same with opioids, right? So an overdose happens when there's too much of the opioid in the brain and too many of the receptors, and it kind of slows down the heart rate, it slows down the breathing process, and eventually that ends up having an overdose. So, keep going. So how to recognize an overdose? So you can have slow breathing or no breathing. Some people may have fast breathing as well. They have a deep snore or kind of like a gurgling sound. You have a slow, erratic, or even no pulse at all, and not responsive to stimulation. And then you might see their lips and nails turning blue or pale. And then we can keep going. So, we're going to talk about naloxone. So if you look into the blue bags, you will see the naloxone is here. And how to respond to an overdose. So if someone is exhibiting any of those symptoms, and you're trying to wake them up, what you would normally do is you would shout their name, you would kind of like push on them a little bit to see if that wakes them up. If those things do not work, what you can do is take your 2 fingers like this with the knuckles and do a sternum rub. And if you do that to yourself, you can feel like it feels uncomfortable. So imagine doing that really hard to somebody. So if they're not responding to that, then that's how you know, okay, this person is going through something, right? So one thing I will say about naloxone is that it is safe to use if somebody does not have an overdose. I know that some people have reservations about it, like what if they're not having an overdose? Like what do I do? You can still use the naloxone if you just have the slightest inclination that they might have it. And just know naloxone only works for opioid overdoses. It will not work for overdoses from any other type of drug. So opioid being heroin, fentanyl. Carfentanil, which is a newer one that we're seeing in the supply, it kind of wavers, and sometimes you might have to use 1 or 2, more than 1. So after you do the sternum rub and identify the person is awake or not, you want to lie them on their back if you can, and you want to gently administer the naloxone. It's kind of like a nasal spray. So you'll take it and you'll spray it into their nose. And then, if they're not awake, you want to call 911. So when you're calling 911, I just want you to know that in New York State law, if you were engaging with them or you have any drugs with you, then New York State law says that you will not be arrested because you're saving somebody from an overdose. So you want to do rescue breaths if they're not breathing. If they're not breathing, inside the packet, you will have like kind of like a face mask in a sense. It's like a thin piece of plastic for like a rescue shield. And you'll put that over their mouth. You want to breathe quickly into their lungs 2 times, and then every 5 seconds, you want to continue blowing air into their lungs if they're not breathing. If you do not know CPR, I highly suggest learning how to do CPR because even for any type of medical emergency and their heart is not beating and they're on the floor, it's really great to know CPR. So while you're calling 911, you just let them know what's going on. And you want to wash them for 2 minutes. If after 2 minutes and they're not responding to the naloxone, you want to give them another one. It's safe to use it more than once. And in addition to that, naloxone only works for about 30 to 90 minutes. So because of that, you want to make sure that you're washing them. I know some people may have some reservations about going into the hospital, maybe for whatever reason, right? We all know like how the system can make things very hard for people who have addiction, so they might already have that feeling like, I don't want to go to a hospital, I don't want to see a doctor, I don't want to go with the police. Those things can happen. We're still really good to encourage them because after the naloxone can wear off, they can go back into an overdose right after that. But continue to wash them and make sure the ambulance comes. And yeah, that's essentially how to use naloxone. And that is my answer. I can take, I don't know where Isaac is, but I'll take a question.
Okay. Yeah, so thank you for the information. I've heard of these trainings before. I just don't really know what's in Narcan. Like, what is it?
So what's inside Narcan or naloxone is kind of like, it's, how do I put this? It's hard to explain. So think of it as kind of like that wedge that kind of removes the opioid from the receptor. So it goes into the brain and it works in that sense. So that's how it removes the overdose from happening, yes. So, but it only works momentarily from that 30 to 90 minutes.
Does it matter how much you do? If it works longer?
How much do you need in terms of?
If you use more than one, does it work longer? Or is
It
that
depends.
for it to work?
It depends. It wavers because again, you don't know how much someone took. Like for example, the naloxone can stop working even sooner than 30 minutes, depending on, like for example, if it's carfentanil or things of that nature. So that's why it is safe to take more than one. So you take it, if you give it to somebody and after 30 to 90 minutes, if they go into overdose again, or after that 2 minutes and they don't respond, you can give them another one. But it's important in that whole process to call 911 because then they can relapse into another overdose.
When you said 2, did you mean you could squirt it twice, or did you mean
One at a time.
one at a time?
Yeah, so you do the
So you
first
can't-
one, and then you wait the 2 minutes. If they're not responding, you can give them another one.
Sorry.
It's okay.
And do you know about Beaver in this neighborhood?
Beaver?
It's supposed to be the ones who respond to folks who are in substance abuse crisis, and you're saying call 911, is that not 988? Or
Oh, well, you can call that. It's just for the training. It's like standards. It's called, say, call 911. But there are other programs that will come, like, for example, there's peer programs that will come if somebody's having an overdose. I'm just not, for the training and how I was trained, I have to say 911. Yeah. But you're on. Yes.
Did you say to lay someone down or like sit them up?
So it's best to lay them down, especially if they are overdosing, because sometimes they can throw up. So if they're sitting up or they're laying on their front, that can cause them to choke. So if they're not responding or they are throwing up, then you want to lay them on their side in the recovery position, which is on their side, and then with their knee kind of like over them. We usually have like I don't have it with me today, but doing that, it will help them in case of the event they're throwing up.
Is there another way to respond to overdose, say you don't have Narcan available? Because I found a woman on the ground before who's overdosed, and we called 911. First they took like 30 minutes to come, and when they came they had no Narcan. So then they had to call another ambulance, who took another 10 minutes. The whole time this woman, very young girl too, was like convulsing and stuff. So is there another way to respond if you don't have that?
So if they are well unconscious, the best thing you can do is making sure that they're staying conscious and making sure that they're awake. I would say that if they're unconscious, to do the rescue breathing to make sure that they're getting the lungs, making sure you're doing the CPR, the chest compressions if you're trained to do that. Other than that, there's not much that's not much I know that you can do about it, but if there's someone here who probably knows. But from my training, that's what you do.
That is
Oh yes. We have another person. Oh yeah, from Halifax.